Patients with a diagnosis of multiple sclerosis sometimes have other health care needs. It's important for them to have someone to manage their primary care, to manage their blood pressure, to make sure they get their annual examinations and other tests, and to make sure that other problems aren't occurring in addition to the MS. Lisa Fox will help describe how she does this for her patients with multiple sclerosis.
True or false? Your MS neurologist is the only physician treating your MS. True or false? Fatigue is only caused by multiple sclerosis. True or false? MS will stop you from living your life. If you answered false to all three of those questions, you are correct. Hi, my name is Lisa Fox. I'm a physician assistant at Johns Hopkins Medical Center, the Neurology Department, MS Division. I've been treating neurology patients for approximately 15 years, and more recently, I've solely focused my attention to MS patients. As you know, MS can be a gamut of diagnosis in terms of relapsing remitting MS, secondary progressive MS, and primary progressive MS. And each one of these disease diagnoses has a different origin, a different in terms of intensity, a different duration, and a different up and down for each patient. But each one of these individual diagnoses has similar symptomatology. As you're well aware, MS is a disorder, a complex disorder of the central nervous system. And what I mean by that, the nerves that communicate to the brain, the cervical and the thoracic spine, the spinal cord, gets disrupted, what I call herky-jerky, because the myelin surrounding the nerve cells becomes inflamed and our immune system starts acting upon that. And when you get this disruption and this communication disruption to your cells, they don't function well. And when they don't function well, you start getting symptoms. And these symptoms could be anywhere from eye pain, optic neuritis, hearing changes, speech or swallowing difficulties, numbness, tingling of the body, weakness of one side of the body or the other, balance issues, bowel or bladder dysfunction, walking difficulties, memory disturbance, memory changes, and fatigue. As you move forward, you might see that you experience some of these symptoms. You could have one or two, you could have quite a few more, or you might just notice that you haven't had many to date. As you're well aware, MS affects at any age, any time of your life. Now, when I first start seeing a patient in the office, they sometimes ask me, Lisa, what do I expect in my MS? What should I be looking out for? And that's a great question. What should you be looking out for? Because sometimes, just sometimes, there's some other factors, some mimickers to multiple sclerosis that could be treatable or reversible. What? Treatable, reversible? Well, yeah, I did say that, but that's not the MS. As you know, multiple sclerosis, we can't reverse many of the symptoms you've already experienced. That accumulation of disability may persist. But what if there's a mimicker of those symptoms? What if there's something that says, hey, I can make this less? And that is where we're going to focus today. We're going to be talking about these mimickers and how your primary care physician can play an important role into helping your MS. So let me take a step back and let me give you a case report to really make it real for you. 2 weeks ago, I saw a 46-year-old female in the office who has been doing great with her MS. She's been stable for about 8 or 9 years since diagnosis, and she has some underlying disabilities, some dizziness, some balance issues, which is stable at the present moment. About a week ago, a week prior to her coming in, she noticed that she's getting a little bit more dizzy, and her balance was a little bit more off. The dizziness was more of a vertiginous, kind of like her spinning in herself. And she noticed that she started shaking of the arms, and this started bothering her. She let it go for a day or two, but then she noticed it was persisting. It made her anxious. It made her feel, oh no, is my MS progressing? So she comes in to see us at the hospital at Johns Hopkins, and I talk to her, and we're listening, and I do an examination, and sure enough, her finger to nose, as you're probably familiar with, was off. Her balance with the tandem was off. So we talk about it, and we do a workup, and what was surprising in the workup is that her thyroid stimulating hormone, her TSH, was significantly low. And this being low caused this shakiness, this sense of the balance being off. I forgot to mention she was severely fatigued. This fatigue was unrelenting for her. And with that, this exacerbation of her old symptoms with these new symptoms was related to her thyroid, not her MS. Yes, her MS was underlying, but this thyroid being off made it worse. So I say to this young lady, I tell her to go see her primary care physician. He sees her, he knows her well, he knows she has MS, and he treats her thyroid. And with treatment of the thyroid and tweaking it appropriately, 2 months later at follow-up, her finger to nose was not anywhere abnormal. Her tandem was back to being normal. Her underlying dizziness was normal, and her fatigue was back to her baseline. So treating that thyroid really allowed her to really minimize, reverse some of her neurological symptoms and keep her as stable as possible. And that is why it's important to have this primary care physician role in treating your MS, to treat you from head to toe as a whole person, to treat you, what I like to say, keep you a well-oiled machine, to make sure that we are eliminating these mimickers for you. Because if we eliminate these mimickers, then your MS can be more stable and they don't have these symptoms that make it worse. For this patient, the fatigue and the tremor were this mimicker, and we thought maybe it was the MS, but it was her thyroid. Other factors could be included: fatigue, numbness, tingling, dizziness, memory disturbance. Are all potential other factors could have mimickers. I could keep going on, but I think you understand. And having that primary care physician in your ballpark, in your part of the MS treatment, will help you stabilize and rule out these mimickers. So let's, again, bring it back to you, fatigue. So raise your hand if you've never experienced fatigue. If you've never experienced fatigue, please let us know, because I'm sure we would like to know the secret, because I'm sure everyone has experienced a sense of fatigue at some point in their life. But in multiple sclerosis, the fatigue can be overwhelming. Every day can just be another day like, oh my, I can't get out of bed. The fatigue is quite intense. Now, what if there's a mimicker for that? What if you have an iron deficiency, or a B12 deficiency? Or what if you don't sleep well, you have a sleep disturbance undiagnosed? That is where your primary care physician can help you and make sure that we can take at least maybe 20, 30% of your fatigue away in terms of treating it appropriately. And your primary care can help you and make you feel better, because even 10% improvement makes you a life-altering change on a daily basis. So talking about that and bringing that to the forefront really makes a difference. I could really go into multiple different characteristics and diagnosis and explaining further mimickers, but I think you have the understanding of what I mean by having the primary care physician helping you in terms of the mimicries of MS. Now I'm going to take a little different approach, because I think this is essential in MS to understand this part what I'm about to explain, and really how the primary physician can help us and help you treat your MS and make you feel stronger. This is what I call the functional reserve. The functional reserve of the central nervous system are the healthy cells that are helping to compensate for your MS lesions that have already been affected. Meaning, the healthy cells are holding the MS lesion's hand. They're making you more stable. They're keeping that MS lesion as stable as possible. It's a little complex, so I want to kind of do a little visualization for you. I want to ask you to think of yourself as an MS lesion. Whatever your MS lesion may be, if it's the most bothersome of numbness, tingling, some weakness, some balance issues, some memory disturbance, fatigue, whatever your most notable and frustrating symptom is, I want you to picture yourself as that lesion in the brain or the spinal cord. And I want you to then picture your 8 or 9 best friends surrounding you. These are your best friends. They are the healthy cells supporting this MS lesion that's already been affected, that's a little bit weaker. And in my example here, it's going to be right arm weakness. So they're helping this right arm weakness stay stable. Now, what if there's some stress in your body? What if something's going on and these healthy cells, these are your best friends, say, hey, I need to go give my attention a little bit to this stress that's going on. That stress may be coming down with the flu, having an infection, urinary tract infection. You didn't sleep well the night before. You had a fun weekend for a wedding. You had a great time, but you're exhausted, and then your body's a little stressed from that. What if you went to a college tour with your child and had to walk around all day? Simple things in life sometimes that make your body so much more exhausted, and your best friends are going to go put the energy for those healthy cells. And then they say, we'll be right back to you as an MS lesion. And your MS lesion, you say, no, don't leave me. I need you. I need to keep my right arm stable. And they leave, and they come, and all of a sudden you scream, don't forget about me, and your right arm's weaker. This is what we call the pseudo-exacerbation, or a false exacerbation. And we need to keep those healthy cells as strong as possible, keep that functional reserve as strong as possible. And one way to do that is have a strong primary care presence in your treating your multiple sclerosis. And by doing that, if we can keep those healthy cells and your primary care involved, we can keep them stable, and we can keep your MS symptoms from causing worsening symptoms. Symptoms of stress, not sleeping well, as I mentioned before. Have your primary care help you figure out if there's underlying sleep disturbance or restless leg. Have your primary check to make sure your blood pressure and your blood sugars are okay. Have your primary care check to make electrolytes, liver changes, infections. Keep you as strong as possible. Keep you that well-oiled machine. Keep those healthy cells as strong as possible to make you a stronger MS patient, to make sure that your symptoms aren't more notable. The flu has been quite intense this past winter, and especially in my area, so I'm going to bring this back to you. If you experience the flu, you know what I'm talking about, but if you haven't, think of another infection. Let's say you feel a little achy, you're starting to come down with the flu, your body's starting to get run down, you feel it coming, your husband, your wife, your children, your best friend, someone, a coworker just had it, so you know it's coming. You start getting the achiness, as I just said, and you start, the next day there's the fever, high fever, and you know your primary care well. And you get in to call him or her and you say, I think I'm coming down with the flu. They know you have multiple sclerosis. And you get in to see them and they give you an anti-flu medicine. Now, anti-flu medicines don't necessarily take it away, but it reduces the duration and the intensity. And for you, that's important because even without MS, the flu can knock you down. And with MS, it can knock you down even further. So getting on this treatment and having your primary care just give you that, yes, you're going to be okay. Let's get you on this treatment, hydration, and give you that reassurance are going to keep those healthy cells as strong as possible. And then your MS symptoms may not be as exaggerated or intense in keeping you strong. And that's just one example of how we can keep the functional reserve as strong as possible. So there's two things. Trying to reduce the mimickers of MS by other treatable, yes, treatable factors. Trying to reduce any stress to the body to worsen your functional reserve. And having your primary care involved in that care for you will make you a stronger MS patient. I want you to live life. I want you to do what you want to do. I want you to take care of yourself, to take care of your children, to take care of your parents, to take care of your animals. Whatever it is you want to do in life, I don't want MS to stop you. And having a strong team with a neurologist and your primary care, bring them into this involvement. Have them be an active part of this to keep you as strong as possible. Thank you.